Asthma and COPD by the home-based nursing staff. What is asthma? Asthma is a disease that causes inflammation, narrowing, and swelling of the airway. It causes repeated episodes of wheezing, breathlessness, chest tightness, and nighttime or early morning coughing. There is not a known reason why some people get asthma and others do not, but it is likely due to a combination of environmental and genetic factors. Triggers for asthma include airborne allergens, respiratory infections, physical activity, cold air pollutants, strong emotions and stress, sulfites, and certain medications. Asthma treatments include breathing exercises, quick-acting treatments which are used as needed for rapid, short-term symptom relief during an asthma attack, and long-term asthma control medications, which are generally taken daily and keep asthma under control on a day-to-day basis, making it less likely to get an asthma attack. Chronic obstructive pulmonary disease, or COPD, refers to a group of diseases that cause airflow blockage and breathing-related problems. It includes diseases like emphysema and chronic bronchitis. Spirometry is a test that is used to measure lung function that helps detect breathing problems and is used to diagnose COPD. Healthy lungs operate by taking in air from the trachea and through two tubes called bronchi. The air is slowly dispersed throughout the lungs by going through bronchioles and alveolus. This process takes oxygen into the bloodstream and removes carbon dioxide from the blood into the capillaries and then into the lungs before it's exhaled. COPD causes the lungs to thicken and become inflamed. When lungs are inflamed, this results in bronchitis with mucus production. Excess mucus in the airway leads to inflamed and narrowing of the bronchioles. Therefore, less oxygen can be inhaled for gas exchange in the lungs. Risk factors for COPD include women. Women tend to be diagnosed later than men when the disease is more advanced and treatment is less effective. Women are more vulnerable to the effects of tobacco and other harmful substances. People greater than 65 years of age, American Indians, Alaska Natives, and multiracial non-Hispanics, people who are unemployed, retired, or unable to work, people with less than a high school education, people who are divorced, widowed, or separated. Serious life transition can lead to deterioration of health due to its association with psychological imbalances. Current or former smokers, up to 75% of people with COPD smoke or used to smoke. And finally, people with a history of asthma. Mild to moderate asthma increases the likelihood of an individual's risk for COPD. However, asthma management can help reduce the inflammation in the airways, lowering the risk. Signs and symptoms of COPD include shortness of breath, frequent coughing or wheezing, excess phlegm, mucus, or sputum production, and difficulty with taking a deep breath. Complications include activity limitations such as difficulty walking or climbing stairs, the need for special equipment like portable oxygen tanks, increased confusion or memory loss, higher risk for other chronic disease like arthritis, congestive heart failure, diabetes, coronary heart disease, and stroke, and increased mental or emotional conditions like depression. Coronavirus and COPD. People with COPD have a higher risk of getting COVID-19. People with COPD have a higher risk for complications and poorer outcomes from COVID-19. COVID-19 can lead to pneumonia and acute respiratory distress syndrome, also known as ARDS. ARDS requires patients to be placed on a ventilator for oxygen due to the body's demand for oxygen. This can lead to respiratory failure, which in turn can lead to organ failure. Ways to stay healthy with COPD include quit smoking, avoid tobacco smoke and other air pollutants, pulmonary rehabilitation, avoiding lung infections by practicing proper hand hygiene, use of supplemental oxygen, reducing stress, exercise, and following your treatment plan as prescribed. Want to learn more? Check out these resources we used, including the Mayo Clinic, Healthline, Centers for Disease Control and Prevention, University of Maryland Medical System, and Operation Home at Health. Check out Operation Home at Health for more tips and tricks on staying healthy with COPD. Thank you.